I grew up in Redwood Falls. I went to medical school at the University of Minnesota Medical School. I practiced for 20 years in medicine around the Twin Cities area, and also took on various administrative responsibilities with Health Partners and with Aspen Medical Group. So I know healthcare quite thoroughly. And it struck me as my time in healthcare that, gee, healthcare is great if you can get it and if you can afford it, but there are too many of us that can't afford it, and if they do get it, they are lucky to start with. So as my career went on, I decided that maybe this policy side of things is important, and I ran for the Board of Regents at the University of Minnesota, and Senator then, Steve Kelly, spearheaded my election not only in 1997, but then again in 2003. And it was when I was sitting on the Board of Regents at the university that I saw very clearly what is the impact of healthcare costs out of control and education. And that the university was seeing a reduction of its allocation from the state because healthcare costs were going through the roof. And that was the aha for me, that healthcare costs need to be fixed. So I think about the 6th district, I think about the future now, and I think, what are the issues that are important to my neighbors, to your neighbors, to you? And I hear 3 things. Maureen, it's jobs. Maureen, it's healthcare costs. Maureen, it's foreclosures on our homes and our businesses. And I take a look at those 3 things, and I think, yes, it is those 3 things, and they are all tied together. This issue with healthcare and the reform that's needed is really twofold. The cost of healthcare and why it's through the roof is 2 things. Its administrative costs are out of control, and they're out of control because we have a system that is set up to do that kind of thing. In some cases, it's for-profit, and certainly we are not paying for outcomes. We are just paying for doing stuff. So we have administrative costs out of control, and then, quite frankly, we have medical costs out of control. And you know this as well as I. How many of you in this room care to admit that when you went into the doctor, a test was repeated because we couldn't find the results, or the results didn't get from one clinic to the other, or the primary care to the specialist, and this happens to everybody. So it is a 2-pronged approach to get healthcare expenses under control. You go after those administrative expenses, you go after the medical expenses, and we're really fortunate right now. President Obama has put healthcare on the national agenda right behind economic recovery and right alongside energy and the environment. So this is going to be a front burner issue. There are only about 24 people in all of Congress that have any background in healthcare at all. And I think it's pretty important that as we drive to a solution in healthcare, that people who know something about healthcare and know something about taking care of patients are actually putting their fingerprints on the plan that comes out, and it can be solved. Absolutely. The single payer issue that you raised, that is a solution that goes after these administrative costs that are out of control that were raised earlier. And I see it as one of several potential solutions. I think that all the solutions should be on the table and looked at. I myself am not wedded to any particular solution. I'm wedded to the fact that it be solved. So if we can solve this administrative cost problem by one method, and we can solve it by another method, it doesn't matter to me. It's we've got to solve the problem. And I think sometimes in healthcare and in elsewhere, people get so wedded to the method of solving the problem that they forget that it's really the problem we're trying to solve, and we shouldn't worry about what means we use to solve the problem. So I would take a very open approach to that. There are certainly advantages in the using single payer. There are some disadvantages, and we would want to have a very open public discussion about the pros and cons before jumping to one solution versus another.